Alain rushed to hospital, saw a homeless man refuse treatment. What he did changed medical ethics forever. This is the incredible true story of how one moment of shocking medical discrimination witnessed by France's biggest movie star became the catalyst for one of the most important healthcare reform movements in European history, proving that sometimes the most profound social changes begin when we recognize that a society's character is measured not by how it treats its wealthy and powerful citizens, but by how it cares for its most vulnerable members during their moments of greatest need, and that true humanity requires more than professional competence. It demands the moral courage to see every person as deserving of dignity and care, regardless of their economic status, social position, or ability to pay for the medical attention that could mean the difference between life and death. November 15, 1976. Hôpital Saint-Louis in the 10th arrondissement was experiencing the typical evening rush that characterized one of Paris's major public hospitals, with ambulances arriving regularly and emergency staff moving between critical cases. The hospital, with its reputation for medical excellence and role as a teaching facility, represented both the best of French healthcare and the complex social dynamics that influenced how medical care was delivered to different segments of Parisian society. On this evening, Alain had been rushed to Saint-Louis after experiencing severe chest pains during a dinner meeting, symptoms that his physician had insisted required immediate emergency evaluation to rule out potentially life-threatening cardiac conditions. At 41 and at the height of his international career, Alain understood that his health was not only personally crucial but also professionally essential, as his upcoming film commitments required physical demands that could only be maintained through careful medical attention. The ambulance ride to Saint-Louis had been swift and professional, with paramedics providing immediate care while communicating with hospital emergency staff to ensure that proper specialists would be available for immediate consultation upon arrival. Alain's celebrity status, combined with the potentially serious nature of his symptoms, had ensured that the hospital's most senior emergency physicians were prepared to provide immediate and comprehensive evaluation, representing the kind of rapid, high-quality medical response that characterized France's healthcare system at its best. But as Alain was being wheeled through the emergency department on a gurney, still experiencing chest discomfort, but stable enough to be aware of his surroundings, he witnessed a scene that would profoundly challenge his understanding of how medical care was actually delivered and who had access to the life-saving treatment he was receiving without question. In the busy corridor leading to emergency treatment rooms, Alain observed a man in his 60s, obviously homeless based on his worn clothing and unkempt appearance, sitting on a plastic chair while holding a blood-soaked cloth against what appeared to be a serious head wound requiring immediate medical attention. The homeless man, later identified as François Dubois, a 62-year-old former factory worker living on the streets for 3 years following. As Alain underwent cardiac testing that would ultimately reveal stress-related chest pain rather than serious heart disease, his attention remained focused on François, who continued to wait for medical attention while his condition appeared to be deteriorating in ways that should have prompted immediate intervention by any medical professional who had taken seriously their oath to provide care to all patients in need. The medical evaluation that cleared Alain of serious cardiac problems took approximately 3 hours, during which François remained in the same plastic chair, still holding the blood-soaked cloth against his head wound, while being ignored by medical staff who walked past him dozens of times without offering assistance. When Alain was finally discharged with instructions for follow-up care and lifestyle modifications that would address the stress factors contributing to his chest pain, François was still waiting for medical attention that should have been provided immediately upon his arrival. The conversation that Alain initiated with hospital administrators about François' treatment revealed attitudes and policies that shocked someone who understood that French society contains significant class divisions and economic inequalities. Hospital officials explained that while emergency departments were legally required to treat all patients, homeless individuals often presented complex social problems that made their care challenging and time-consuming, and that limited resources needed to be prioritized for patients who could demonstrate ability to pay or who had social support systems ensuring proper follow-up care. These explanations, delivered with bureaucratic language that disguised discriminatory policies as administrative efficiency, represented exactly the kind of systematic bias that violated both medical ethics and fundamental principles of human dignity that should govern healthcare delivery in any civilized society. What Alain decided to do in response to this medical discrimination would transform not only François' immediate circumstances, but also create lasting changes in how French hospitals understood their legal and ethical obligations to provide care to all patients, regardless of their social or economic status. Alain's immediate action was to personally guarantee payment for François' medical care, while demanding that hospital staff provide the same level of professional attention and treatment that had been given to him, demonstrating that medical competence was not limited by a patient's ability to pay, but was a professional obligation that applied equally to all individuals seeking emergency care. But beyond addressing François' immediate medical needs, Alain understood that this incident represented a broader pattern of healthcare discrimination that affected thousands of vulnerable individuals throughout France who were being denied medical care based on their economic status rather than their medical needs. The investigation that Alain initiated, working with legal advocates and healthcare policy experts, revealed that François' experience was representative of systematic discrimination affecting homeless individuals, immigrants, and other economically disadvantaged populations who faced barriers to healthcare access that violated both French law and international medical ethics standards.
The research documented cases throughout France where emergency departments routinely delayed or denied care to patients who appeared unable to pay, where homeless individuals were treated with contempt rather than compassion, and where medical professionals allowed economic considerations to override their ethical obligations to provide care based solely on medical need. These findings became the foundation for comprehensive healthcare reform legislation that transformed how French hospitals were required to treat all patients, establishing legal protections against discrimination and creating oversight mechanisms that would ensure equal access to emergency medical care regardless of economic status or social position. The François Dubois Act, named in honor of the homeless man whose suffering had exposed systematic medical discrimination, established France as a European leader in healthcare equity by creating legal frameworks that prohibited economic discrimination in medical care, while providing funding mechanisms that ensured hospitals could provide comprehensive care to all patients without financial penalty. The legislation also established patient advocacy programs that would monitor hospital treatment of vulnerable populations and provide legal recourse for individuals who experienced discrimination based on their economic status, social position, or ability to pay for medical services. Within 18 months of the incident at St. Louis, over 200 French hospitals had implemented new policies that transformed how emergency departments approached patient care, creating protocols that prioritized medical need over economic status, while providing training that addressed the unconscious bias that had previously influenced how different patients were treated.
For François personally, his encounter with Alain had provided not only the immediate medical care that saved his life, but also connection to social services that helped him secure stable housing and support services that enabled him to rebuild his life with dignity and purpose. François became a powerful advocate for healthcare equality, sharing his story at medical conferences, policy hearings, and community organizations, where his articulate description of medical discrimination helped change professional understanding of how economic bias affected healthcare delivery and patient outcomes. The annual Healthcare for All conference, established to commemorate the day Alain witnessed medical discrimination at St. Louis, became one of Europe's most important healthcare policy events, bringing together medical professionals, policymakers, and patient advocates to address ongoing challenges in healthcare equity and accessibility. Most importantly, the transformation inspired by François' suffering demonstrated that healthcare equality requires more than legal requirements and professional standards. It demands the moral courage to recognize that every person deserves medical care delivered with dignity and compassion, regardless of their economic circumstances or social position. The medical ethics reforms that emerged from this incident influenced healthcare policy throughout Europe and beyond, creating new standards for patient treatment that recognized healthcare as a fundamental human right rather than a service available only to those who could afford to pay for it. The contrast between Alain's immediate comprehensive medical care and François' neglect demonstrated the true character of a healthcare system that claimed to serve all patients while actually delivering care based on economic status rather than medical need. But the transformation that followed demonstrated how individual acts of moral courage could inspire systematic changes that honored both professional medical ethics and fundamental human dignity, creating healthcare systems that truly served all members of society with equal compassion and competence.
The long-term impact of the healthcare reforms inspired by François' experience extended beyond individual hospital policies, creating comprehensive transformation in how French society understood the relationship between economic status and access to medical care. Research revealed that medical discrimination against homeless individuals, immigrants, and economically disadvantaged populations was systematic throughout France, with emergency departments routinely providing different care levels based on patients' apparent ability to pay rather than medical needs. Documentation uncovered heartbreaking stories of individuals who died from treatable conditions because they were denied timely care, families bankrupted by medical bills that wealthier patients never faced, and healthcare workers pressured to prioritize economic considerations over medical ethics. The François Dubois Act represented the most comprehensive healthcare equality legislation in European history, establishing legal protections prohibiting discrimination based on economic status while creating funding mechanisms ensuring hospitals could provide quality care without financial penalty. The legislation established medical care as a fundamental human right under French law, making it illegal for healthcare providers to delay or deny treatment based on ability to pay, while requiring emergency departments provide equal professional care to every individual seeking assistance. The act created a national patient advocacy program monitoring healthcare delivery throughout France, investigating discriminatory treatment complaints while providing legal support for individuals experiencing bias based on economic status or social position. International attention followed, with delegations from Germany, the United Kingdom, Italy, and Netherlands visiting French hospitals to study healthcare equality implementation, leading to similar legislation recognizing medical care as a human right rather than service available only to those affording premium treatment.
The economic impact exceeded expectations, as eliminating discriminatory practices actually reduced overall healthcare costs by ensuring medical problems were addressed promptly rather than delayed until requiring expensive emergency interventions that could have been prevented. For Francois personally, his transformation from ignored homeless patient to national healthcare advocate demonstrated potential existing within individuals when receiving appropriate support and recognition for their contributions